Much of the burden for caring for those patients falls to nurses. This was a national day of action for Canada's nurses, and in BC, they made their voices heard right outside the health minister's office. Frontline nurses are tired, frustrated, and demanding to be heard as they struggle to keep the healthcare system running and warn it could collapse. Here's Penny Daflos.
They are the backbone of our healthcare system, doing the exhausting and delicate work of hands-on care, and they are buckling under the fourth wave. BC nurses are leaving full-time jobs, some working on a casual basis, others not looking back, and the strain is building.
Nurses who normally have 4 patients are now taking care of 8 to 12 patients. Not okay. Not okay.
In a day of action across Canada, nurses in BC took their message to the health minister's constituency office in East Vancouver. CTV News has spoken with some 24 nurses in recent months, all of whom expressed frustration with Adrienne Dix's leadership.
You come and walk a mile in our shoes.
Canceled vacations and 12-hour shifts without food or bathroom breaks are common, with 24-hour shifts now routine and overtime hours nearly doubling.
In larger hospitals, we're seeing a huge amount of nurse vacancies in many of our units.
The impact to patient care is compounded by the steady rise in COVID patients. This Kamloops grandmother died in an emergency department waiting room unseen for hours amid a COVID surge and critical staffing shortage.
Nurses are working short every day in every ward across our province.
They are voicing their frustrations after years of opioid deaths, COVID deaths, and wildfire upheaval.
They're psychologically injured from some of the things they're witnessing.
But they're also offering solutions.
More nurses in the system, more seats in the schools. We have internationally educated nurses who are trying to become nurses here.
The BCNU estimates some 800 internationally trained nurses are in the province waiting 5 years or more for assessment, training, and approval when they're needed right away to give those on the front line a well-deserved break. Penny Daflos, CTV News, Vancouver.